Right, let's get straight into it. There's a new drug that aims to prevent hospital admissions and deaths from COVID in adult patients and children aged 12 and over. This drug is called Sotrovimab and the brand name is Xevudy. It belongs to a class of synthetic neutralising monoclonal antibodies, also known as nMABs. These antibodies have a double action effect. The first action is that they bind to the spike protein of the COVID virus and they prevent the virus from entering into the healthy cells, which means that the virus is not able to replicate itself, i.e. it cannot create copies of itself and multiply. The second action is that it clears the body of any cells that are infected with COVID. In one study, Sotrovimab has been shown to reduce the risk of hospitalisation due to COVID in those eligible for the drug by as much as 85%, especially in those who are unvaccinated and who are thought to be higher risk than vaccinated. In terms of administration, Sotrovimab is usually given intravenously as a single infusion at a total dose of 500 mg over a 30 minutes duration. So who's eligible for this drug? If you've had a COVID infection confirmed within the last 5 days, and the onset of your COVID symptoms has been within the last 5 days, and you also have to be in a high risk group. So who is not eligible for this drug? If you require hospitalisation for COVID-19, you're not eligible. If you require supplemental oxygen to help increase your oxygen levels, you're not eligible. If you're a child under the age of 12, you're not eligible. And if you're a child who weighs under 40 kilograms, or if you're an adult who weighs under 40 kilograms, you're not eligible. So let's look at who is in a high risk group. So in the high risk group, you have patients who have Down syndrome, if you have sickle cell, if you have solid cancers, or you've received radiotherapy within the last 6 months, or chemotherapy within the last 12 months, certain patients with hematological malignancies, otherwise what we call blood cancers, if you've had kidney disease, including those with a transplant or a failed transplant within the last 12 months, liver disease, including those with cirrhosis or liver transplant, if you immunosuppress, or you might be on a medication such as corticosteroids, cyclophosphamide, tacrolimus, cyclosporine or mycophenolate. If you have conditions such as HIV or AIDS, where you have a high viral load or your CD4 count is less than 350 cells per milliliter. If you're a recipient of solid organ transplants, which are not covered in other categories, and if you have neurological conditions such as multiple sclerosis, motor neuron disease, myasthenia gravis, and Huntington's disease. Now there is another nMAB that can be given as a combination drug called Ronapreve. However, this is not as effective as Sotrovimab with the Omicron variant. Ronapreve is given within the 7 days of the onset of symptoms and has shown to reduce risk of hospitalisation and death by 70%. Bear in mind, Sotrovimab has shown the same by 85%. Now, if you're unable to take nMABs for whatever reason, such as maybe allergy or a reaction to the drug, the next option will be to take the antiviral treatment. And this is an antiviral drug called Molnupiravir, which I've covered in my previous video. Molnupiravir has been shown to reduce hospitalisation and death by 30%. So you can compare that with the nMABs, which is between 70 to 85% depending on the type of drug. So now let's look at who's eligible for Molnupiravir. So it says here that eligible patients aged 18 and over may be treated with the drug at a dose of 800 milligrams. So that means you take 400 milligram. That means you take 4 200 milligram capsules orally every 12 hours for 5 days. And that's if you're not able to take the nMAB. So patients should strongly be encouraged to complete the 5-day course, and your course is not extended beyond that 5 days. Arrangements should be made to ensure that the patient can access the treatment without having to attend the service in person. So you might have a courier delivery, or the medication will be collected on your behalf of your patient. It also states that Molnupiravir, which is the antiviral drug, is not recommended in pregnancy. So all individuals of childbearing potential who are prescribed Molnupiravir should be advised to use effective contraception for the duration of the treatment and for 4 days after the last dose of the drug is given. So it also advises that if you're a health professional given the drug, that all pregnant patients need to be reported to the UK COVID antiviral pregnancy registry, and there is a number which they can use to be followed up on. Now, in terms of how do we get access to the treatment, Well, there have been what they call the Local Commissioned COVID Medicines Delivery Units, also known as CMDUs, which have been asked to prescribe and administer the nMABs to patients in the highest risk group and who have a diagnosis of COVID-19, which have been proven on a PCR test. So these are in different trusts and what we call CCGs. And so basically, if you're a patient, you'll be written to. If you're a patient in a high-risk group, you either have been sent an email or a letter posted to your address to advise that you're in a high-risk group and you're eligible for this drug. Bear in mind, this drug is for only those who are tested positive for COVID-19. So in most cases, you'll also be given a PCR swab to keep at home so that you can do the test quickly. If you're positive, your local CMDU will contact you directly, telling you that you're eligible for the drug. It also states that it is likely that some patients will not receive the letter or email, that there might be some PCR tests that do not match directly to your health record. So what happens in this case, if you've had a positive test and you've not had anything back within 24 hours, you should contact your GP surgery and they will be able to refer you to the local CMDU. If your GP surgery is closed, you should then contact 111, who can then organize a referral. In terms of the antiviral drug Molnupiravir, it's going to be available to a broader cohort of patients under a trial called a panoramic trial. Now, this trial is a UK-wide clinical study which has been sponsored by the University of Oxford and funded by the National Institute of Health Research to find out if new antiviral treatments for COVID-19 in the community reduces the need for hospital admission and to help people get better sooner. So if you're a GP practice or you're an individual patient, you can sign up to take part, and the eligibility criteria are listed below. So these are the patients eligible to participate in the panoramic trial. So if you have COVID-19 symptoms which have begun in the last 5 days, if you're positive PCR test for COVID-19, if you're aged 50 and over, or you're aged 18 to 49 with a pre-existing condition, which includes a respiratory disease such as COPD or asthma, if you've got chronic heart problems, chronic kidney disease, chronic liver disease, chronic neurological disease, Down syndrome, type 1 or 2 diabetes, if you've got immunosuppression, your obesity with a BMI of greater than 55, if you've got mental BMI of greater than 35, if you've got severe mental illness, if you're a resident in a care home, or if you've been judged by the recruiting clinician to be clinical vulnerable. So, are these drugs actually game changers, or are they a bunch of hyped medication like we've had previously? Well, as they say, the proof is in the pudding. Only time will tell. But for now, it is actually better to have a range of options than to have no option at all. So if you like this video, please feel free to subscribe to my channel.